Good morning, everyone. Can you hear me okay? Just give me a someone give me a thumbs up.
We sure can.
Perfect. Thank you, Cecilia. We're going to go ahead and get started because we've got a lot of information to share. I know we've got a few who are still joining, and a few of our presenters actually are just getting themselves organized, updating their Zoom this morning. It's always an excitement when we've got these morning webinars. But I wanted to start the meeting off in a good way with a land acknowledgement. And so I actually wanted to share a story. So yesterday I was at the hospice with a palliative care patient, and I met with the patient's family as I usually do in our spiritual room. And the Oak Ridges Hospice is such a beautiful spot. If you haven't had a chance to visit, I do encourage anyone, if you're up in North Durham, to have to come in and have a visit. It's a long building with large windows overlooking a park to the south. And as we were talking, the patient's son reflected on how thankful that he was to have such a beautiful facility in our rural community with beautiful people, the nurses, the staff, the volunteers, and the physicians. But he went on to reflect his thankfulness, not just for the hospice and its people, but for our country. And he looked at me and he said, "We're lucky to get to live in this country. It's a special place." And perhaps perhaps it was the moment in the current political climate that we're even more aware and thankful to call Canada home. And so as I was driving home from that visit, I reflected on how thankful that I am for this land and our country and the Indigenous people who have cared for this land for so long. And so today, as we start this meeting, I respectfully acknowledge that I live and work on the lands and traditional territory of the Mississaugas of the Scugog Island First Nation. The Central East region, Durham region, is located on the territories collectively known as the Williams Treaties First Nations, which include Curve Lake, Hiawatha, Alderville, Scugog Island, Rama, Beausoleil, and Georgina Island First Nations. I am grateful to recognize the Indigenous people for their care and teachings about the land and all living things, and commit to continue to actively engage with local Indigenous communities to build meaningful relationships and learn about the resilience and caring people. In the spirit of reconciliation, I recognize the importance of turning this acknowledgement of my privilege into action. And in my role, I have had the honor of being able to learn from many Indigenous elders and knowledge keepers, and I'm so appreciative of their teachings and guidance. I tend to be someone who wants to do and to act, but I'm continuously reminded about the importance of listening and learning, and I commit to continuing my efforts to grow in these areas to help foster even more positive relationships with Indigenous peoples. My personal commitment to reconciliation is to work towards a health system that not only reflects health equity, but honors and celebrates Indigenous cultures and all of the many wonderful teachings we can learn from each other. While Canada has a dark history in terms of its treatment of Indigenous peoples, the work I see coming from our own community, including our Indigenous Cancer Program and the work that we're doing here at the OHT, makes me hopeful and optimistic for a brighter future. I encourage everyone else on this call to think about what your commitment is to reconciliation as well. And without further ado, we will get started with our meeting. So I'm just going to do some housekeeping. So I remind everyone to mute your computer or use *6 to mute your telephones, just so that we don't have any additional background noise. If you do have any questions, please raise your hand or submit the question through the comment box. And just a reminder that this session is being recorded, and a link of the recording will be shared following the presentation. There's no conflicts of interest that we have to disclose today. So I am very excited to introduce our panelists for today. Dr. Suleiman Firmly and Dr. Angaran Sinaraja have worked very, very hard with Amber Howard, our navigation lead at the OHT, to be able to bring SCOPE to our community, and we are very much indebted to them and the work that they have done to move this forward very, very quickly and efficiently, and have done a really great job. Very excited to introduce our SCOPE nurse navigator, Louise Hansen, who brings great expertise and knowledge. She's been a nurse in our Durham community for many, many years, and is very experienced and brings her knowledge to this team. So we're excited to meet her, to introduce her today. And then we have also with us today Moish Ali from the SCOPE program provincially, who's going to provide us some details of experiences of SCOPE in other areas, of successes, and some areas to learn from. Do you want me to hand it over, Suleiman? Do you want to take over the objectives, or do you want me to run through the objectives?
I can take it. I can take over. No
Sure, I'll
problem,
hand it
Becky.
over to Suleiman from here.
All right. Thanks, Becky. Just very quickly, just to introduce the objectives for today. So today we'll be talking about the Durham OHT SCOPE program, a little bit about the team and how to get in touch with the team, a little bit of a history about SCOPE program as a whole, and some information about how to register and what is on our pipeline for the future for SCOPE. Next slide, please. And for the agenda for today, so we're just on time right now. So we've gone over little welcomes and introductions. Again, we'll talk a little bit about the history of SCOPE in the future. We'll talk about SCOPE from the Durham OHT perspective, go over some questions and answers, and then discuss the registration for SCOPE today. Next slide. All right, and I'm going to hand it over to, I believe, to Melish.
Yes, morning, everybody. Very nice to meet everyone and very excited for your journey for SCOPE. Congratulations to the team who has put in a lot of efforts on this. I'm going to go ahead and start with Dr. Pauline Pariser's introduction. She is the founder and has helped develop the SCOPE program. Unfortunately, she's teaching today, so you're stuck with me. And I am a bit under weather, so I apologize for my voice right now. Dr. Pauline Pariser is actually a professor in the Department of Family and Community Medicine. She currently runs the provincial program as a primary care lead for SCOPE. However, before this, she was actually a primary care lead for the Midwest program. She has recently stepped down as a chair for Midwest Toronto. That happened about 4 years ago. And again, she was also chairing the Midwest Toronto Family Practice Network, which she has stepped down just because of a lot of work involved in the provincial aspect of SCOPE. Next slide, please. SCOPE came into fruition for the unaffiliated or solo primary care providers in the community. It's still led by them. It is for them, and they are the ones who is driving the program in all regions in Toronto or GTA sites or outside the GTA. It's a platform for primary care engagement. It is to provide support to the solo practitioner, to the unaffiliated primary care providers, for them to efficiently provide care for their patients. Next slide, please. A bit of a history about SCOPE. SCOPE started as part of a quality improvement project. Initially, 50 primary care practices were identified whose patients had the highest number of emergency department visits at Toronto Western Hospital. Physicians and patients were engaged at the time to explore what it would have meant to manage care more efficiently in the community. SCOPE was initially offered to 25 practices, but due to a strong interest, the initiative actually then expanded to 30 practices, which is now 300 at the Midwest region. At the time, there were researchers involved from St. Michael's Hospital who provided literature review, did the environmental scan, and that's how SCOPE really kicked off. As part of growth, we have they had one site to 4 more sites that they were able to launch within the first 2 years of the program development. From 5 Toronto sites to all OHT Toronto sites, and then 9 outside the GTA. Today, we have more than 3,500 enrolled PCPs in the Greater Toronto Area, going beyond a total of 18 sites, actually. More than 100,000 total contacts or requests from PCP since its inception, and on average, more than 2,100 calls per month, with more than 55% of those calls are diverting ED visits. Next slide, please. This is just a bit of a map showing how SCOPE has expanded over time. We have 9 sites in Toronto. They are part of GTA sites, 6 demonstration sites that are not part of the GTA. They're not part of the Toronto sites, but they're part of the neighboring Toronto sites, and 2 sites supported by local funding with Middlesex London, and we have added another site, and we're very excited for Durham joining this journey with us. Next slide, please. What SCOPE does uniquely is that it provides a single point of access. For Durham, that single point of access would be Louise. What we learned when the SCOPE program was being launched was that family doctors did not want to have processes after processes where they were speaking with one person, then with another person, and then not having to have their support or their question answered. So they wanted one single person to contact, and in almost all the sites, we have nurse navigator. And so nurse navigator becomes that one-stop shop for them, helps build that relationship with the doctor, provides ongoing communication, provides closure to the request that they're sending, and becomes really that specialized access that they don't have with the time they have that they want to spend with the patients, but they're now spending with calling multiple places and not getting their answer. So that's really how the nurse navigator concept came into place, to make sure that the family doctors had that one single point of contact. Next slide, please. Here it's a little bit of a visual in terms of how a SCOPE process looks like. It's a virtual program. It's an interdisciplinary program, and it's connecting primary care providers in the community to the nurse navigator, who is mostly situated in a hospital site, providing, again, a single point of access. When the primary care provider sends a referral via phone, fax, email, through Ocean, if you're using that, then the nurse navigator is able to take it on, triage, and then connect the family doctor with the appropriate services. Some of the sites have general internal medicine consults available over the phone, and the nurse navigator are crucial in facilitating those. Some sites also offer home and community or Ontario Health at Home support coordination. There is also support about diagnostic imaging. And then over time, the sites have developed pathways that are unique to their own hospitals. Next slide, please. Again, this is another visual, but I can go into a little bit of an example on this. Humber River Hospital has developed a unique pathway called an urgent care neurology program. And through that pathway, a nurse navigator receives a call from the family doctor. She triages the referral. They have built in an inclusion and exclusion criteria of the referral. And through that referral, the nurse then becomes the eyes of the specialist. And then she shares the information with the specialist. And then they decide how soon the patient could be seen in the urgent care clinic. We also have a headache neurology program that's offered through Women's College Hospital in partnership with the Midwest Toronto program. And through that program, we have a dedicated nurse practitioner who triages the referrals and then works with the Women's College Hospital neurologist specifically for headaches. Again, having an strict inclusion and exclusion criteria just because of the program's requirement. But these partnerships were made over time and were obviously worked out with having the nurse navigator support. Next slide, please. In terms of the expansion of the programs, this is what it looks like in terms of over the year development. If we see here the South Lake program that's marked in red, we have unfortunately lost South Lake due to funding issues. Their hospital couldn't support the program anymore, but it was a very sad situation. We're still in contact with them. If something does work out, they might be able to kick off the program again. However, if you see like all the other sites, and based on the years of development, they're still going strong. And their nurse navigator, again, is a pioneer in making sure the relationships are continued and strengthened in that sense. I'm going to go ahead for the next slide, just talking about a bit more about pathways here. So no one site will mimic another site. All sites are very unique in terms of their own pathways, their services, and things like that. Majority of the sites will start with one nurse navigator. As the time goes by, the sites are able to then add, for example, general internal medicine consults, having a cardiology pathway, having a fracture clinic pathway. Just wanted to give an example about fracture clinic pathway. It started from Sunnybrook, where the nurse navigator there realized that patients who had identified fractures were still sent to emergency department because they didn't have direct access to the fracture clinic that way. And so they started having conversations with the fracture clinic and the orthopedics. And then at that point, the fracture clinic pathway came in fruition. And that was really the first step towards the pathway building. And that model was then taken to and for the other sites. And now you can see there are 10 sites who offer fracture clinic pathways. So this is just an example of how the pathways are becoming more and more becoming a more of a star in their programs. But again, no one pathway will look the same in the other site. It will depend on your leadership, on your discussion, on the setup of the clinic, existing clinic. So it all depends on that. But I do want to identify that it will be unique to your site, and you have that flexibility on creating your pathways just as how you would want to make it work. And that brings me to the end.
Good morning, everyone. I guess it's my turn now. So we're just going to talk about the Durham OHT SCOPE program. Next slide, please. So SCOPE is seamless care, optimizing the patient experience, and the plus is streamlined access to outpatient services. So today is our big launch. The SCOPE model promotes patient-centered interdisciplinary care, which is the foundation for the Ontario Health Teams, the OHT. And includes the creation of a navigation community of practice. We have the potential with this program to reduce emergency department visits, provide patients with more equitable and pragmatic access to team-based care and specialists, establish an effective channel to deliver best practice and emerging standards of care, and provide an opportunity for ongoing physician engagement. Next slide, please. So I'll introduce myself. I'm Louise Hansen. I'm a registered nurse, and I am the SCOPE nurse navigator for the Durham OHT. I graduated from Confederation College in 1998, and over my career, I've worked in many different areas. from, little hospitals in Northwestern Ontario to working in Durham region for the last 21 years, supporting diabetes education. I worked in a physician's office for many, many years. And the last role that I left, I was the home and community care coordinator in an Indigenous community. Next slide. One of our PCP co-leads, Dr. Firmley, completed his medical school in 2015, residency in 2017 at the University of Toronto. While in residency and shortly thereafter, he completed extra rotations in psychotherapy and mental health, palliative care, and metabolic health, type 2 diabetes and metabolic syndrome. He was born to parents who came to Canada as refugees from Afghanistan. In addition to working in local primary care clinics, he works as a travel medicine physician at Universal Travel Health and is also the clinical director at Rosslyn Diagnostic Clinic in Ajax, which offers diagnostic imaging and cardiology services. In his spare time, he enjoys being a husband, father to 3 young children, playing pickup sports, including basketball, soccer, and helping with nonprofit and charitable initiatives both locally and abroad. And our other PCP co-lead is Dr. Sinya Harna. He completed his medical school in 2001 and family medical residency in 2003 at the University of Toronto. He then completed a year of palliative care training at the University of Calgary. He's the physician lead for Integrated Clinical Pathway and Chronic Disease Prevention Management lead. He's also the division head for palliative care at Lakeridge Health and the Dr. Gillian Gilchrist Chair in Palliative Care Research with Lakeridge Health and Queen's University. So for right now, SCOPE, we're starting with just the nurse navigator. So you can see on this slide, primary care reaches out, and we have several ways for you to connect with me. You can call the 1-855 number. You can email scope@doht.ca. We do have a fax number coming, and we also have the WhatsApp group that some of the docs use to reach out and stay connected with each other. Next slide. So the way the program is looking right now, Monday to Friday, 8 to 4. Obviously, we're just starting. So as we see what the needs are, we can change these things around. So my role is to provide general advice and assistance navigating hospital, community, and SCOPE plus services resources for your patients. This includes search for appropriate hospital OHT-based resources, communication between primary care and hospital physicians, and expedited patient care when possible. So examples of when to give me a call. If you need a hand finding a specialist, mental health, harm reduction, counseling, foot care, chiropody, registered dietitian, nursing, and primary care resources, diabetes and other chronic disease education programs, and assistance with the referral process for external resources in the community. Examples of when not to reach out to me. So the point of my job is not to take over the good flow that you already have going in your office with your own staff. So I'm happy to, find the forms, the referrals, those types of things that you need, and then I will forward that information back to you. Uncomplicated referrals, so something that is straightforward, we'll continue to have your office support that. Clinical work, and then follow up notifying patients of appointments. And I'm actually going to turn it over to Amber now.
Good morning, everyone. As I am Amber Howard, I am the navigation lead for the Durham Ontario Health Team. It's my absolute pleasure to be with you. So we're very thrilled to have the nurse navigator, have Louise on board to be supporting our primary care practitioners in Durham. And we are looking to the future. So we're already looking at, are there ways for us to look at some of the other kind of more standardized pathways that you see that Moesh spoke about, an internist, diagnostician, home and community care. And we're working closely with Dr. Singaraja and other practitioners around, the potential for a palliative pathway through SCOPE as well. And then as we move forward in the program, we're definitely going to be putting in place feedback loops. We want to know from you what other pathways would be of service to you. And as well, part of what Luis will be working on and just paying attention to are what are some of the common requests that she keeps getting over and over that will, over time as this program evolves, will help us identify what the unique and specific needs are within the Durham region. So please stay close when we reach out with those opportunities for your feedback. Please let us know what's working for you about the program and where you might see opportunities for us to evolve it. And we're all very excited to bring another really value-added service to our primary care practitioners in the region. Thank you.
So my name is Aingaran, as mentioned and introduced by Luis already. So this is the time for us to field some questions and have a discussion. We've heard the great things that SCOPE can provide. This is the first time Durham is getting it, and this is very exciting. And so I'll open the floor for questions that people might have. I believe you can come off mute if needed, or you can just drop it in the chat as well. I wonder whether the rest of the panel has any other discussion points they want to mention during this time.
I can say something, quickly, Dr. Singaraja, just while people are kind of getting their head around what they might want to ask. For those of you that are currently actively in the WhatsApp group for our primary care practitioners, I've been a silent fly on the wall in that group for a while as we've been getting ready to roll the SCOPE program out. And it's amazing to see the level of support that's, our primary care practitioners do for each other in that group. Please continue to do that. Luis is in the group already. And, as of the launch of the program today, she will be monitoring things. And if, there are often times in that group where someone will say, I'm looking for this or that specialist or support, and someone else very quickly kind of responds, reach out to this person. There are also times where there seems to be a little bit of ambiguity as to the best course forward to support that practitioner. And so in that case, those will be the times where Luis will be kind of watching and will likely reach out to that primary care practitioner directly to see if there's something that she can do to provide assistance.
Great,
Thank you, Amber.
thanks. So I see some questions rolling into the Q&A. The first question is around part of care, so I can take that. So perhaps it's time to also mention the new PCM Durham website that the team has been working on. And that is a part of care section in there, and that is the referral forms in there that you can use. It is something that we know needs to be made more efficient as well. And that's why Amber has mentioned this exploration of adding that within SCOPE as well in the future. Was there anything else anybody wanted to mention around the new website, perhaps, the PCM Durham website? Okay.
Sorry, Angaran, I just couldn't get myself off of mute. I apologize. We will add the PCN Durham website into the chat so that everyone has access to that. But we do encourage you to navigate to the PCN Durham website. And if anyone on the call today is not registered in the WhatsApp community, we do encourage you to register in the WhatsApp community for Durham Primary Care Network, because it is a vast source of information and networking, and so it is can be quite helpful. So do register for that as well, and let us know if you have any issue getting registered.
Great, thank you. Next question: what help will SCOPE provide around mental health, and perhaps you can also answer around internal medicine? Who wants to take that?
I guess I can take that. just send me over your requests when it comes to mental health, and I will do the digging, and I will find specifically what you're looking for. There's lots of services in Durham region. It's just a matter of having that time to dig and find and connect and do the referrals. And I'm happy to do that as part of my role for you.
And I can add on that as well, Angaran, did you have something else to add there, Louise?
Nope.
Perfect. We have recently at the OHT expanded our leadership team, and both Angaran and Suleiman are a very important part of that leadership council for the primary care network. And additionally, we have added a role for mental health as well. So we will be introducing our leadership council more formally at our June the Joy in Medicine event. So we do encourage everyone to add that, save the date for your calendar. But we are very much working on clearer mental health pathways in Durham region to help improve access for patients and reduce the administrative burden for us as primary care providers. So until we've got it much more clear, the SCOPE program and Louise may be a source of a resource for our providers to use.
Great, thank you. Certainly great plans and vision for the future, it sounds like, so I'm glad to hear that. The next question is around what detail is required for the referrals? Is it the entire consult request that gets sent to Louise? Is it just find me the resource, for example, the neurologist to investigate a medical issue? How would you respond to that?
I can jump in on that, Louise. I think, and maybe Mewesh, if you're still on the call, you could speak to how some of the other SCOPE sites, because we're new, deal with this. But I think there will be a little bit of working this out in partnership with Louise in terms of identifying the amount of information that she needs to be able to properly provide service to the primary care practitioners. And maybe Mewesh, you can speak to what other SCOPE sites do.
Yeah, so it's different for every case, right? So some of the cases, Louise will need more information. What it usually starts with, most of the time, a doctor usually calls or sends an email if it's a protected email. Then that works out. But if you want to send a referral, just because the referral has more information, Louise can let you know what would be the best way to do that. But it usually starts with a question. Hey, I'm looking for a neurologist. I have this patient having headaches. She's pregnant. I don't know what to do. This is urgent. And then Louise should be able to guide you. And then, as Amber mentioned, this will be work in progress. And then Louise will be able to tell you the next steps accordingly.
Thank you. And I think what I'm hearing is that, this is new in Durham, lots of learnings that we need to do. We will figure out our own way that works well and best for Durham, and the Leadership Council is committed to that. But in the meantime, best is to reach out to Louise, see what information is needed or not. But ultimately, I think we also want to point out that this is not a central referral place. That is not what SCOPE is. So you don't send every consult here. It is only when those has complex patients, has help needed, there's questions that you have. And eventually, you will learn who is the best place to send it to, and then you don't need to come to Louise anymore in the future. So it's also almost like a mentorship, a navigator-like resource as well, isn't it? Sure. Home oxygen referrals is a question that has been asked. How does one make a referral for home oxygen in the community?
So I can answer that if you want, Louise.
Go ahead,
or do you want to answer that, Louise? Or would you prefer that I answer that?
Go ahead, Becky.
Okay, so for home oxygen, that is actually a referral that is done directly through our home oxygen providers. So this, if you weren't sure, you can use our Scope Navigator. So this is exactly the types of things that will be helpful, right, with the Scope program. So a lot of the things that go onto our WhatsApp group, sometimes they're easily answered and sufficely answered, but sometimes, you know, we are all sharing information on through our PCN, and maybe we don't, you know, it's actually making the, you know what you need to do or who you need to refer to, but you just can't find the right person, or you're not sure the timelines, or you start to get bounce back referrals. And these are the really challenging referrals that are going to be super helpful to use your friendly Scope Nurse Navigator. For home oxygen, just generally, there are several home oxygen providers in our region. So Community Respiratory Services is one, ProResp is one, Medigas is one, and you actually make referrals directly through those services. And you can visit their websites, they're online, or if to get their referral forms. It's typically embedded in your EMR as well.
Great, thank you, Dr. Ray. Next question, there's a comment around the links are not working. It does work for me, so I'm not sure, Samina, why it's not working for you. Perhaps it's your browser. If anybody else wants to mention anything on that, you can. Around how, okay, so then this great service is starting. Okay, how do we use it? How do we sign up? And those are some of the next slides that are coming up. So hold on. Any other questions that you might have? You do need to register, and so that's again something they'll go through right after I'm done talking, and then you can access Louise. Any other questions you might have? Well, maybe I will hand it back to the others then to keep going. Again, feel free to keep adding questions into the Q&A or to the chat, and we'll continue to answer those. Thank you.
So to answer those questions on how you access me, we'll go through that in the next couple of slides. Next slide, please. So you can go to pcndurham.ca to learn more. To register, I do believe Amber has posted the link in the chat. So you just click on that link and then you're registered to the program. If you've already registered, thank you so much. You don't need to register again. But if you haven't registered, now's the time to get doing that so that we can get working together, because you do need to be registered to access the program. Next slide, please. If you prefer a QR code and you want to use your phone to get on the form right now, you can do that. And your first call with me, you can qualify for CME 1 Main Pro Plus credit. So you make your first call to me. You can call the 855-515-DOHT number. You can send me an email and then I can in turn call you, whatever works best for you. Following your first call with me, I will give you a code, and I will also give you a link for a 5-minute post-reflective exercise. And then you will receive your credit shortly after that. Next slide, please. And I think we're turning it over to Dr. Friendly.
Thank you, Louise. So yeah, I don't want to really add too much, but I just want to say that it's not often that as primary care doctors that we have services and programs that are funded and that are of no cost to us, that are there to really help us in our practice and for our patients, really. So we're very lucky that we had this opportunity to get Scope rolling for our area. And it's really, I would say, a grassroots initiative. I was involved in really volunteering before even any specific titles or roles became formal. And it's just because really just out of passion to bring this for my own selfish reasons so that I could have access to this, but more importantly, so that we could all have access to it. And I think that there's many other opportunities for us to work together and feed off of each other's feedback and suggestions to keep on innovating and bringing amazing programs like this, to help our community together. So that's pretty much all I have. Really, thank you for coming from on 8 a.m. on a weekday. It really says to we've had at least 20 people on the call, which is great. And I see Dr. Lubna's hand, so please go ahead.
Hi everyone. Sorry, I'm in commute, but I just wanted to honestly really just give you guys a pat on the back because this is something so meaningful for all of us, especially with smaller practices where we don't have a lot of admin support. But I did want to just add one thing, Solomon and Angaran. Thanks for taking all those questions. I think I've learned a lot about scope in the process. But when I think my advice would also be like really involve your admin teams so that I think Angaran said it best, where like, let's say we do learn something useful from Louise. I think it's important to communicate that with our front staff. Just so like in a sense, you're building your own sort of database of those difficult things. So this way we can all kind of develop the program together because, sometimes something can be such a pain for referrals. And then 6 months later, a few new docs come in or specialists and it becomes much more smoother. So then we pivot and into something else. And I think that's how I envision, our scope program will grow. So thanks everyone again. And like everyone said, this was a long time coming for all of us. So really we're excited to see where it goes.
Thank you, thank you so much, Dr. Lubna. And Becky, go ahead.
Thank you. I would encourage everybody to get registered for the WhatsApp group, as I already mentioned. Register for Scope. Please be this team is amazing. They are really incredible people. We're very, very lucky to have Suleiman and Angaran leading this, and to have Amber and Louise as well developing the SCOPE program for our region. Please be patient. So please use the service. Be patient with us. We're just getting this off the ground. Many other regions, when they've started, as you heard from Awish, started with one pathway. And what we decided was we wouldn't do that, right? Rather than develop a single pathway only, we're going to work with challenging referrals. So we're going to help you with all the challenging referrals that you have. If you have knowledge of particular pathways that are really challenging or particular referrals that are really challenging, please send us that information so that we can start developing pathways around that. Like, for example, if you think, oh, gee, neurology, I can never, or neurosurgery, how do we even access that outside of our region? Those kinds of things, let us know so we can start to work on that in the background. And we will do our very, very best to meet the needs and move this forward. And then Cecilia is very lovely, reminding me to remind everyone to save the date for our June regional event. So the Durham OHT and Durham Primary Care Network are presenting Joy in Medicine, which will be a celebration of all of our primary care teams and partners to come together and really help to find that joy in medicine. So it promises to be a very good night, June the 10th at the Harmony Event Center. So please save the date for that. More information to follow. And I'll hand it back to you, Suleiman, for final remarks.
Thank you so much, Becky. So I think we'll if there's any other last questions or comments, I think this would be the best time to take it. Otherwise, I recognize it's a Tuesday, it's a weekday morning, so everyone has to get back to work. So really, the bottom line for today was really just to introduce the program and share the information for how help contact Louise. And I think that's really the main takeaways for today. I really don't want to belabor more than that. So any other thoughts from anybody else? Otherwise, I think it's reasonable to end early, get an extra 10-minute head start on our work days.
Thanks, Suleiman. Have a happy
All right.
Tuesday, everyone.
All right. Take care, everybody. Thank you so much
Bye-bye.
once again.